Hello everyone, and welcome to the Module 1 pre-quiz review for NURS 306. I'm Dr. Mary Bonmass, and I will be facilitating your learning during this review. This review will cover chapters 1 through 4, which will be the content on Quiz 1. Listed here are the objectives for Chapter 1. Know that the quizzes used in this course align and reflect your attainment of program, level, course, and modular objectives. These you can read at your leisure, but know that there is a reason for the objectives, and there are activities assigned to and aligned with these objectives. Additionally, the study guide provided in your module is intended to direct your learning for the quiz specifically, while the modular and the course objectives are met by various activities, such as your mastery questions and the VSIMs. The study guide is specific to Quiz 1. So this is why you always want to pay particular attention to the study guide specifically and what is listed in it, and to the review, which will focus you in on the questions in the quizzes. So there are multiple ways of assessing your attainment of the overall objectives of this course. You'll notice in this review, specifically in Module 1, their questions are going to address specifically nursing knowledge, that is your nursing knowledge, and information that you will have learned, hopefully, to think critically so that you can make clinical judgments about nursing assessments, nursing interventions, particular to patient education and to the nursing diagnosis. And throughout taking your quiz, make sure you pay attention to bolded words such as most important, first priority, and best response. So you may have questions that have two possible answers. Go back when you see bolded issues in the question itself and try to think critically to make the judgment on which is the best given the information you have provided and the information you learned from your text through the various learning activities. Each slide, as we go through this review, talks to some of the things you want to focus on, such as in this case, a priority intervention, and related to the topic, which here is obscured labeling on a drug container. And then I've listed the section title that will refer you back to your text if you need further information. So for example, many of the containers that you draw drugs from may be multi-dose containers or multi-dose bottles. So the labeling is extremely important. Again, you are responsible for the drugs you give, and you are the last line of defense for all your patients receiving drugs. So it's really important that if a drug container does not have clear instructions, perhaps it's soiled in some way, that you make sure you discard the entire bottle and the contents and obtain a new bottle. This relates to patient safety and making judgments. When a drug label is soiled, obscuring some information, the safest action by the nurse and the priority action by the nurse is to discard the bottle and the contents, because drug labels contain a great deal of important information, far more than just the name of the drug. Probably contains a concentration of the drug, an expiration date, administrative directions, and precautions may be missing when a label is not clear. So rather than put your patient at risk, take the safest intervention, which would be to discard that particular drug. And there may be some documentation with that discarding of the drug. However, it is the safest intervention for your patient. Next one, looking at nursing interventions related to safe administration of unfamiliar drugs, make sure that if you do not have full information about a drug, in other words, it's unfamiliar to you, that you find a recent reference source. The nurse is responsible for all medications administered and must find a recent reference source to ensure the information learned about the medication is correct and current. Using an older drug guide could be dangerous because it would not contain the most up-to-date information that research has now made available. And asking the pharmacist or the PharmD does not really guarantee accurate information will be obtained and could actually harm the client if the information is wrong. Patient education also is a big focus of what we do in nursing. And it's important that we're aware of and make sure the patients are aware of some of the adverse effects, sometimes known as the side effects of a medication. Related to the nomenclature here of adverse effects, we know that negative or unexpected effects are known as adverse or side effects. There are other names for effects of drugs, and you are responsible for knowing that. For example, teratogenic effects are effects on a fetus and obviously not much concern to an older adult, whereas toxic effects can occur when a medication is taken in larger than recommended doses and can cause an increase in serum drug levels. Those are toxic effects, whereas paradoxical effects are drug effects that have opposite of what is intended. Again, I refer you to the section titled Introduction in Chapter 1 for further reading. Now, many of the slides, including just about everything that's included on the study guide, refers to nursing knowledge. These type of questions are strictly so that you can demonstrate you have this knowledge that's needed for that database you have in your mind to make clinical judgments and to use critical thinking. For example, if you're beginning a course, say such as this one in pharmacology, you should expect to know and have in your knowledge base that when you talk about pharmacotherapeutics, you're talking about the impact of drugs on the body, you're talking about the body's response to a drug, and you're also talking about adverse and anticipated drug effects. This is to say that nurses study pharmacology from a pharmacotherapeutic level, again, which includes the effect of the drug on the body's response to the drug, and both the expected and unexpected effect of a drug. You probably learned in NURS 305, the fundamentals class, that subjective and objective nursing assessments are needed. And if we talk about the assessment done after a drug is given, we can discuss that after a medication is administered, the nurse assesses the client for drug effects such as therapeutic and adverse. This is also evaluation. So evaluation and assessment are sometimes confused and sometimes can be used interchangeably, but the whole idea is after you give a drug, you should be watching for the therapeutic effects of a drug and the adverse effects. If you're looking at assessing for allergies or pre-existing conditions, you're too late after the drug is given. Those should be done before administering the medications. And those are objective and subjective assessments that you make. Asking the patient about certain situations, how they're feeling, etc., related to the drug effects, and we're observing things in our vital signs, etc., that are needed to make the determination of the drug effects. Again, in patient education related to discharging a patient to home, which you will do over and over if you work in a hospital or in an outpatient clinic that does procedures. So it's important to know that the nurse is responsible for providing thorough medication teaching about drugs and the drug regimen to ensure that the patient or the client, whichever term you prefer to use, knows how to take the medication and when to notify the provider of effects that are not expected. If adverse effects arise, the client is taught to call their healthcare provider and should not self medicate with over the counter drugs, which could mask serious symptoms that perhaps the healthcare provider should know about. So, again, providing thorough medication teaching about the drugs and the drug regimens are an important component when teaching patients during the discharge to home process. Also related to patient education is drug safety information. The FDA, or the Food and Drug Administration, is responsible for controlling and regulating the development and sales of drugs in the US anyway, and allowing new drugs to enter the market only after they have been subjected to rigorous scientific testing. This is important that you give this information to your patients regarding the FDA, especially if they ask you about it. So, depending on the conversation that you're having with the patient, that could direct some of your patient education. So, if a patient is wondering about the safety of a drug, this is when you might introduce to them the concept of the Food and Drug Administration. And you can also tell them that they could access some of the information on the FDA's website, and that official government websites usually have the suffix at the end of .gov, .gov. Now, there are always special categories and information that's necessary, and again is part of your patient education responsibility, and this includes the drug categories during pregnancy. So obviously you're not going to be giving this information to an elderly patient, but if your patient is pregnant or is of childbearing age and is taking the drug, this might be important information to you to consider. There are various drug categories that are addressed in box 1.1 in chapter 1. Category A indicates that adequate studies in pregnant women have not demonstrated a risk to the fetus in the first or the later trimesters. Category B indicates that animal studies have not demonstrated a risk to the fetus. However, there have not been adequate studies in pregnant women to demonstrate risk to the fetus during the first trimester of the pregnancy, and no evidence of risk in later trimesters. Category C indicates that animal studies have shown an adverse effect on the fetus, but no adequate studies in humans. And lastly, Category D reveals evidence of human fetal risk, but the potential benefits from the use of the drug in pregnant women may outweigh the potential risk. So again, in your patient education sessions, if this is appropriate, it's important that you know these categories related to pregnancy. Also, in your practicums, you will notice that some of your patients are involved in clinical trials or may have heard about clinical trials in the news and have questions about some of the newer drugs as they come on the market and how they are tested in clinical trials. So you can explain if you were asked. And again, we're looking for the best response when replying to questions posed by your patients, that during the preclinical phase of testing, drugs are tested on animals and are not available to clinics. In phase 1, the drug is tested on volunteers who are usually healthy young men, and it is only in phase 3 studies that a drug is made available to prescribers who agree to closely monitor patients who are getting this medication. Now, again, noticing in the charts and from patient conversations about drug trials, phase 1 studies might come up. Again, in answering questions from your patients or in just having this knowledge. If you were to think of who would be the best to be included in a phase 1 study, you may want to refer to the section titled here on this slide, Phase 1 Studies. Phase 1 drug trials usually involve healthy young volunteers because chemicals may exert an unknown or harmful effect on ova in women that could result in fetal damage when the women become pregnant. So this way, using healthy young male volunteers eliminates this risk. There are drugs that are tested on both men and women, but women must be fully notified of the risk and sign a consent stating that they understand the potential risk of birth defects. Younger patients, younger than 18 generally, are not included in phase 1 studies and are eliminated from participation. Staying on the topic of drug trials and referring to phase 3 studies, phase 3 studies involve the use of a drug in a vast or very large multi-center clinical population in which clients or patients are asked to record any symptoms they experience while taking the drugs. Nurses indeed may be responsible for helping collect and analyze the information to be shared with the FDA, the Food and Drug Administration, but would not conduct research independently because nurses do not prescribe medications unless they are advanced practice nurses with certification as APRN or an advanced practice registered nurse. Moving next to some of the scheduled drugs, and again I refer you to box 1.2 in chapter 1. Let's talk a minute about Schedule 1 drugs. Schedule 1 medications have no medical use and are never prescribed, versus Schedule 5 medications have the lowest risk for abuse and are found mostly in such drugs as antitussives or antidiarrheas, but they are not sold necessarily over the counter. But Schedule 1 medications have no medical use and so are not prescribed. An example of this would be heroin. You don't see prescriptions for heroin. You see prescriptions for withdrawal from heroin, but not from heroin itself. Heroin is a Schedule 1 drug. Schedule 2 drugs, which are opioids generally, they have a higher abuse potential and are classified as Schedule 2 drugs because of the severe dependence liability. Some of these drugs you probably are familiar with, and these might include like the Vicodin or the Oxycontin drugs. These are the type of drugs that have a high abuse potential and are highly addictive. Moving off the subject of the scheduled drugs for just a minute, and a nursing intervention that you should be aware of when it comes to unfamiliar drugs. And I can repeat this several times if you don't mind, because it is so important. And again, found in the section titled Introduction. A nurse's drug guide provides nursing implications and patient teaching points and are the most useful nurses, in addition to need to know drug information that is very user friendly in an organizational style. It's very important that if you're unfamiliar with the drug, that you consult a current nurse's guide. Websites are useful, but unless you're very sure of where that information is coming from, it may not be specific to the nursing interventions, which include that patient teaching and user-friendly style that you can find in a nursing reference guide. Moving back to some of the phase studies, having information about phase 4 studies and generic drugs is frequently important for a patient to know. It's easily explained to the patient that, especially if they're asking, well, can I take a generic version of this drug? It's especially important for you to know that and to teach your patients that when a new drug enters the market, it's given this time limited patent. There's a lot of money and time and effort that goes into development of drugs, so that a patent is required to protect that information, but it is time limited. Generic forms of the medication are not produced until that patent expires. It may be important that your patient is comforted by knowing that they may prefer a generic drug, but there is none available, and frequently the patent expiration period can take up to several years. Staying with generic drugs, the question again asked by patients is, can I have a generic drug, or perhaps because of the cost, or perhaps they're saying, I don't want this generic drug, I want the brand name because I know it's more effective. Your patient education could include that most generic medications are completely safe and may be identical to the brand name, except generic medications are often less expensive. However, this does not address the client's concern about safety. There may be subtle differences between a generic drug and brand name drugs, and so they should be aware of that. However, generally, most generic drugs are very safe and can be cost effective. You may want to add, there could be some subtle differences and they may notice them, but they have to weigh the benefit of the cost and the safety when considering generic drug. Also, this is not to mention that some insurance companies only pay for generic drugs. So having the patient know that a generic drug is safe is important. Regarding over-the-counter drugs, it's really important for the nurse to specifically question a patient about their use of over-the-counter medications, because the clients may not consider them important and may not mention them. So in the nursing assessment phase, we should be asking, are you taking any over-the-counter drugs? You may have to give some examples because they might not know what over-the-counter actually means. Depending on if English is a second language, that's a colloquialism when we say OTC or over-the-counter. So make sure your patient understands what you're talking about when you're talking about over-the-counter drugs, and you ask this question specifically during your nursing assessment. Let's move to chapter 2. Again, the objectives in this course are aligned with some of the activities and what we want you to demonstrate, either through your mastery questions and getting to a certain level, or in your quizzes. And specifically related to the quizzes, your study guide focuses you in. So these are the items on chapter 2 that you're asked to focus on for the quiz. Although there's more to know in the text than just these things that you're going to be quizzed on. It's just another assessment of you demonstrating your achievement of the course and program learning objectives. So again, a lot of the questions are related to nursing knowledge, nursing interventions, and patient education. In your nursing knowledge database, in your mind, you should be aware of certain terms, including the term agonist. Agonists are drugs that produce effects similar to those produced by naturally occurring neurotransmitters or hormones or other substances found in your body. There are other terms, non-competitive agonists, and drugs that react differently and affect receptors differently. But when you're talking about a drug agonist, this is the drug that will interact directly with receptor sites to cause the same activity as one of the natural chemicals would at that drug site in the receptor sites. Now, this is a rather complicated concept, So I would refer you to the section titled Receptor Sites if you need further clarification on that. Drug agonists. Now, related to your nursing assessment, and again, this would be before the administration of a drug, you would know that drugs are metabolized different in different groups of patients or in diverse groups of patients. Under the title biotransformation, which is another name for metabolism, you may want to spend a little extra time in reading this section if you're not understanding that certain drugs, and you have to make now a clinical judgment based on what you're learning in your assessment. So, for example, the liver is the most important site of drug metabolism or biotransformation of a drug. If the liver is not functioning effectively, as perhaps in patients with cirrhosis, drugs cannot metabolize normally, so that toxic levels could develop unless the dosage is reduced. So if you're assessing a patient and you realize that they have a condition of the liver and you're referring to or talking about or thinking about drug metabolism, keep that in mind that the liver is the most important site of drug metabolism. Important that the actual concentration that a drug reaches in the body results from the dynamic equilibrium, if you will, involving several processes. Those include absorption from the site of entry, and that can be from the muscle or GI tract if taken orally, or maybe subcutaneously if given by a sub-Q or subcutaneous route. Distribution to the active site, biotransformation, as we just talked about on the previous slide, or metabolism in the liver, and excretion from the body. So distribution, biotransformation or metabolism, absorption, and excretion are important components of dynamic equilibrium and should be kept in mind by the nurse when administering drugs. When talking about absorption, drug absorption is influenced primarily by the route of administration. For example, IV administration is the fastest method of drug absorption, and given a drug orally is the slowest way a drug will be absorbed. Therefore, it's very important in the nursing knowledge realm that we know that the route of administration that has been prescribed is going to affect the absorption of that said drug. Referring to pharmacokinetics and solubility, there's a section titled Distribution that you may want to go to for further clarification. Know that factors that can affect distribution include the drug's lipid solubility and ionization, and the perfusion in the reactive tissue that you're affecting. The lipid solubility of a drug doesn't influence absorption, metabolism, or excretion. It affects distribution. Now, frequently in practice and in your practicums, you will see that drugs are ordered to be given at the same time. So it's important to know that some drugs compete with each other for the protein binding sites, and this can alter effectiveness or can cause toxicity when the two drugs are given together. So it's important that you know these things, and again, you consult a nursing guide to check to see if the effectiveness of giving two drugs together can be altered. Again, they can either alter effectiveness or cause toxicity, making it less effective or more than the desired effect, which would be a toxic effect. Know also, and you can explain to patients if asked, what first pass effect is and reduce drug dosages. Again, there's an entire section titled First Pass Effect. So know that drugs that are taken orally are usually not always, but usually absorbed from the small intestine directly into the portal venous system, which then delivers these absorbed molecules into the liver, which immediately breaks the drug into metabolites, some of which are active and can cause effects on the body, and some of which are deactivated there and can be readily excreted from the body. So as a result, a large percentage of an oral dose is destroyed at this point and never even reaches the tissues that they are intended to reach. The first pass effect, also known as first pass metabolism or pre-system metabolism, is a phenomena of drug metabolism whereby the concentration of the drug, specifically when administered orally, is greatly reduced before it reaches the systemic circulation. Pharmacogenetics, again for your nursing knowledge, and in the section titled Genetic Factors, this is explained. But basically, pharmacogenetics is the area of study that includes mapping of the human genome. In the future, medical care and drug regimens may be personally designed based on a client's unique genetic makeup. So again, this is just a knowledge question of the term and defining the term pharmacogenomics. A situation that you're going to see a great deal, and knowing the nomenclature, it almost is inherent in the actual word, polypharmacy. And what is the responsibility of the nurse and the nursing interventions related to polypharmacy? So whenever two or more drugs are going to be given together, first consult a nurse's guide, a current nurse's guide or reference text for a listing of clinically significant drug-to-drug interactions of the drugs that you're going to be giving. There may be the possibility of changing administration times so that you're not giving drugs together that might have a drug-to-drug interaction. But technically, the nurse cannot unilaterally make this decision unless there is a policy specific at that institution that drugs can be changed. But it's important to know that you may need to contact the provider and the pharmacy if this is the case where you know of a drug-to-drug interaction. The best thing, or you're not sure of a drug-to-drug interaction when there is polypharmacy or two or more drugs being prescribed for one administration time, that you consult a nurse guide to drug administration, and it has to be a current reference. And then take appropriate interventions to either get this changed by the prescriber or follow an institutional policy regarding this. When considering therapy interactions, it's important that all healthcare providers have a complete list of a client's or a patient's medications specifically to avoid drug-drug interactions caused from one provider ordering a medication unaware of another medication that the patient is taking that was prescribed by someone else or is a new medication that's going to be added to their regimen. So by contacting a provider and knowing all the drugs that a patient is taking can reduce the risk of a drug-to-drug interaction when everybody is not fully informed on all the medication someone is taking. And again, this is referred to polypharmacy, and it is very common. Many patients go to multiple providers who give other medications for their specific expertise, but knowing all of them is particularly important. Having the nurse know this, because we're the last defense for the patient, so in our assessment and in our patient education, it's important that all providers are aware of all medications, so this will reduce the likelihood of drug-to-drug interactions. Moving next to Chapter 3, the objectives are listed here, as well as in your learning guide, in each module, and the study guide. And you can see they're listed here, and specific to this quiz, we'll go over a few things, including your nursing knowledge related to reduced therapeutic effects. Taking too little of a medication would mean that the therapeutic levels intended are not being reached, and the drugs will be less effective at lower dosages. That's pretty straightforward. So when we have medications that are prescribed, it's important that we know the intended drug effect, intended prescribed amount, so that we get, hopefully, the therapeutic effect. Sometimes patients will tell you that it's hard for them to take the recommended dose of several of their medications, so they tend to take lesser amounts, like breaking the pills in half or skipping a day, etc. And it's important that you know, and during your assessment, you put together these facts, that this reduces the therapeutic effects. Related to chapter 4, I believe this slide is out of context, should be with chapter 4, but I'm going to address it now because it has to do with risk of injury. So in chapter 4, we deal with primarily the nursing diagnosis and our interventions. So I'll direct you to box 4.2, related to risk of injury. Sometimes older adults, most of the time those living independently, if they're prescribed a new drug that is known to cause sedation, a priority intervention for the nurse and their nursing diagnosis for that particular client is a risk of injury. Because of the sedative effect of a medication, this could set the patient up for falls or other complications that sedation can contribute to. And this is a safety risk for the client and should be one of the major concerns and should be listed in the nursing diagnoses. Risk for injury. Getting back to chapter 3 and that misaligned slide, nursing knowledge related to allergic reactions is extremely important when you focus on safe medication administration, which we should be doing at all times. Being alert to adverse effects, what to assess, and how to intervene appropriately can increase the effectiveness of a drug regimen, provide for the client's safety, and improve patient compliance. To maintain the client's safety during drug therapy, it's extremely important to be aware of their allergy histories and know how the effects of their allergies interfere and decrease safety when given medications. Also know that patients can have allergic reactions to certain drugs. So it's important when you are, especially if it's a new patient that you have no knowledge of, but during your intake you notice that the patient's allergic to, say, penicillin, you should ask the patient and assess the exact nature of their response. So the nurse should ask additional questions in this case of someone who says they have a drug allergy, and I would maybe put that in quotations to ascertain the exact nature and response to determine if it is a true drug allergy. Clients may confuse secondary actions of a drug with an allergy. And so again, for the nursing knowledge, it's important to assess and get all the details to assess the exact nature and the patient's response when they're given a certain drug, so that you can determine, is this an allergy or is this just a secondary effect that would not stop the patient from needing and receiving the medication in question. Now, just for your knowledge, and it can boil over into your patient education, a drug allergy is the formation of antibodies to a drug or a drug protein. This causes an immune response when the person is next exposed to that drug. A drug allergy does not occur at the first exposure to a drug, generally speaking, but that second exposure can be when the allergy is actually manifest. Again, if it's an unknown drug and you're giving it for the first time, your responsibility is to assess, have they ever had a reaction to this drug or a similar drug? And having no knowledge of that, then The second dose would be, especially if it's one of those drugs known to cause allergic reactions. The classic example is penicillin. Next, moving on to the concept of superinfections that's addressed in chapter 3. It's important to educate the patient related to the likelihood of a superinfection that might occur by the destruction of normal flora that's actually beneficial and keeps other bacteria, if you will, in check within the body. A really good example of this is taking antibiotics for vaginal infections, and that antibiotic can kill other good flora that keeps, say, the yeast in the vaginal cavity in check. So if you kill the good flora, the yeast may take over. So you fight one infection, but you get a super infection with yeast because of the super infection concept. So, and it's important for patients to know this and to be given specific information on what to look for when they're taking an antibiotic specific to kill a bad germ and what it can actually do inadvertently but predictably to the good flora in the body. Now, here is a question, and as you'll find out from knowing me throughout being in this course, cardiology or cardiac nursing is the specialty that I feel most expertise in. And so I frequently give cardiac examples, but this one has nothing to do with my expertise. This has to do with a fact of the cardiac effect of some drugs. But because every patient you will see has a heart, these are often of primary concern. So a lot of patients who take potassium, they take potassium because they are on diuretics, which causes them to lose potassium. So providers, to avoid that effect of losing potassium given diuretics, they will use potassium sparing diuretics. And part of the problem with potassium sparing diuretics is they might do too good of a job and can create the situation known as hyperkalemia, which means too much potassium in your blood. Not to be confused with hypokalemia, Hypo kalemia, which is too little. Both hyper and hypokalemia can have severe cardiac effects and lead to death. So it's important when you are giving a potassium sparing diuretic that you know and you assess for hyperkalemia. Monitoring for the cardiac manifestations, because potassium, again, is that important electrolyte in the action potential of the cardiac cell, and it's needed for cell membrane stability. When potassium levels are too high, the cells of the heart become very irritable and rhythm disturbances can occur. Being prepared for cardiac emergencies and cardiac monitoring is a priority, and it's more important than some of the other things that you find in your assessment of a patient. So always being mindful of the cardiac manifestations of the certain drugs that you give. And if it's a potassium sparing diuretic that you're administering, you'd be watching for hyperkalemia. And if it's a diuretic with a regular effect, you might be watching for hypokalemia. In either case, both produce cardiac manifestations that can be life-threatening. Now, using some nomenclature or wording related to here adverse effects of a drug overdose. If a client takes an overdose of a medication, this is poisoning. Poisoning occurs when an overdose of drug damages multiple body systems, leading to potential for fatal reactions. So it's important when you're assessing certain medications that your patients are given that you're watching for the effects of these medications afterwards, because you want to avoid that situation of where that headache medication wasn't working so well, so I took an extra drug. So you'd be watching for that drug overdose potential and the poisoning effect, which again can occur when an overdose is damaging body systems and leading to possible fatal reactions. Anaphylaxis is a serious condition, and it is brought up here just as an example of a medication that you would be given during an anaphylactic situation. And the drug, again, we don't go into too many specific drugs specifically in chapters 1 through 4, but in the case of anaphylaxis, one would anticipate that epinephrine would be given. If your patient is experiencing anaphylactic, that generally requires epinephrine to be given. So it's very important to recognize anaphylaxis and to know that, or anticipate at least, you're not prescribing, but you're anticipating that epinephrine is going to be prescribed. Finally, moving to chapter 4, the objectives are listed here, as are the items on the study guide, which primarily deal with understanding the nursing process. Now, the nursing process you have seen in Nursing 305 in your fundamentals course, and nursing actions are addressed in chapter 4 related to the nursing process. So if a client uses recreational drugs intravenously, it is likely to have ineffective self-health maintenance, which is one of the nursing diagnoses that you might have learned about in 305. Therefore, actually, the naming of a nursing drug diagnosis when drug abuse is suspected, a likely one, again, would be ineffective self-health maintenance, because someone is using drugs perhaps for recreational purposes, and that's very likely to have health maintenance consequences. I'll refer you to section 4.2 in the text for a little more information regarding the nursing diagnosis related to drug abuse, which, by the way, is a very big problem in our country today, not only with younger people, but also with older adults. Now, we should have rationales for everything we do, and when you're doing your nursing care plans, you may be asked for a rationale for something. And the nurse uses this nursing process as a decision-making, problem-solving process to improve the safety and effectiveness of the care we give. So the main purposes of the nursing process do not really involve giving your patients a voice or collaborating with your patients or even giving a framework for documentation. The nursing process is there to ensure that the care you give is safe and effective. And that's the rationale for the use of the nursing process. Sometimes people get confused with evaluation and assessment. So I guess one could say that all evaluation includes assessment, which is a step in the nursing process, but not all assessment, the first step of the nursing process, involves evaluation. So although the terms are similar in use, after you give a drug, while you are physically perhaps assessing a patient, the step of the nursing process that you're using is technically evaluation. So if you give a drug, depending on what it is, and you're looking for the effect, that's using the evaluation phase of the nursing process. Evaluation allows the nurse to review what has changed since intervening to determine whether the nursing care has a positive and therapeutic effect, moving the client towards a more healthful life and less harmful life. Although assessment and evaluation can be confused, generally after a post-drug administration, the step in the nursing process you use is evaluation, although you use your assessment skills to evaluate the patient after you give a drug. Staying with the evaluation phase of the nursing process, how do we evaluate? So during that evaluation phase that we're talking about here, the nurse evaluates how effective care has been in meeting the outcome goals. So the outcome goals are determined for a specific patient, and this forms the main basis of evaluation and actually supersedes the client's knowledge level and adherence. So when we're talking about evaluation, we want the most important data we can use is whether our patient is achieving the health outcomes that are set for that particular patient. During the implementation phase of the nursing process, this is also sometimes referred to as the intervening phase or the intervention. And if your intervention is drug therapy, it involves 2 steps. So this is not always clear to people, but it's very important that you know that implementation phase of the nursing process, when we're talking about drugs, involves administering the medication and documentation of that medication. So during the implementation phase, the nurse administers and documents the medication. Very important to know which phase you're using if you were identifying your intervention. Your intervention is to give the drug and document related to the drug. Now, you probably heard in 305 in your fundamentals class a lot about gathering data and about making clinical judgments. You'll see in your VSIM you have to gather data from an electronic medical record to make a clinical judgment and do an intervention. And this comes during the assessment phase of the nursing process. And one of the important situations, especially if you want to make a clinical judgment about a patient who has a lot of stressors that might interfere with their own self-care, it's important to assess all the factors that could be adding to the patient's overall situation. So collecting data and then making a clinical judgment about that. So even collecting data on the level of social and financial support is important to making a clinical judgment of where you may then move to a nursing diagnosis. And this is going to occur right in the first step of the process when you're assessing. This is to say that in certain situations, insurance, financial support, stability in the home, and social supports are very important to determining adherence to future drug regimens. So it's very important to prioritize this in the assessment phase. Also during the assessment phase, this time before giving the administration, Earlier, I talked about assessment versus evaluation. Assessment generally comes before drug administration, whereas evaluation is after when we talk about the finite phases of the nursing process. But during the assessment phase, again, before you administer the drug, it's important for you to gather all information about what might be a chronic condition that a patient might have. So a chronic renal status will indicate the ability for a patient to excrete a drug, whereas liver function is needed to assess metabolism. Weight, hydration, fluid status are less significant than renal function and determining if there is a chronic condition going on unless you're determining the patient's ability to excrete the drug. So when assessing the client's drug regimen related to their ability to excrete a medication, we should be looking at their kidneys. And so we would look at lab values that indicate kidney functions. And so that would be important for that physiologic integrity of the patient. So again, those are part of the things you would assess before giving a drug to a person with a chronic condition. Now, patients frequently stop taking their medications early for a variety of reasons. They might think that their symptoms are gone, so they don't need to take it anymore, or they might be stopping their medications because of the expense, or they may want to save some of it for the next time they get into this particular situation. Either way, this is kind of referred to in the nursing diagnosis nomenclature as non-compliance. It is a recognized nursing diagnosis, and I would refer you to box 4.2 in chapter 4 for further information. But basically, the client who does not adhere to the prescribed treatment, which is the action that can lead to other situations, for example, antibiotic resistance. Someone stops taking their antibiotic early, so the condition doesn't go away, and then they need to prescribe it again, and perhaps again. This can lead to antibiotic resistance. It's important that patients are instructed on taking the full amount of the medication when it's given. And if we are giving a nursing diagnosis a name to that situation when someone doesn't follow their prescribed regimen for taking a drug, noncompliance would be the one that would fit a nursing diagnosis for this patient. Frequently, knowing about and assessing early on and knowing about a patient's chronic conditions can be very important. And sometimes patients are not that forthcoming, either by just simply forgetting or intentional, with giving information to their provider. And a provider who's going to be prescribing medications needs to have this information. So if you're taking it in, doing an intake or admission for a patient, and in your assessment phase, you realize that the patient has a certain chronic condition that can affect drug metabolism and possibly excretion, you should assess whether this information has been given to all the providers that the patient has seen. So for example, if the client tells you, oh yes, I have renal failure or chronic liver disease, and you ask, has this information been given to the provider? Or you notice in the provider's note that there's no mention of this, the action that you would want to do, and again, it would be a priority for you to do, is to contact the admitting physician that wrote a specific order to make sure they are aware of the chronic condition that clearly their patient may not have as informed them, because they may want to change their prescriptions. So that's a time, and although it's one of the least liked tasks of a nurse, calling a prescriber is indicated. And it's a priority that you contact the provider who prescribed a certain medication if you think that they do not or are not aware of a chronic condition that the patient just told you about. And again, you would find this information out during the assessment phase of the nursing process. Again, focusing on the nursing action, addressing safe medication administration. It's important that if a prescriber is not clear in a prescription for a drug, in their order for a drug, that call them and ask for clarification. You might not want to do this task. No one likes to call for clarification, but it is essential, and it is the best action one can take if you're not sure. Or say, for example, that a patient maybe is scheduled for surgery in the morning, and you know that generally patients scheduled for surgery are NPO or something like this. They're not to be given meds orally, and you see that this is not noted. You may want to call and just clarify. Did you want the patient to be NPO, or is there not the need for that? So it's important to clarify when you know there might be a safety concern. And oftentimes taking medications orally before a surgery is a safety concern. That would be a time for you to call the provider to clarify an order or the prescription of a certain med or meds given a certain situation. This will end the pre-quiz review for Module 1. Again, we're focused on chapters 1 through 4 in your text, and please refer to the handout when viewing this review. Good luck, everyone, on your quiz, and please feel free to email with questions related to any of the situations listed in this review. Thank you again for your attention in this rather long but important content-laden review of the Module 1 content.